see, there's no change in Medicare for seniors. None. Under my plan.
Right now, Medicare fight. Mitt Romney tried to draw out the difference between his plan and the president's, literally. But with Ryan's plan also in the mix, whose plan will the public get behind? And next,
Washington politicians have failed us. Jobs are scarce. Federal debt has skyrocketed. Taxes in Westchester and Rockland are out of control.
congressional races heating up. We'll be talking to a Republican challenger looking to unseat a 20-year incumbent. And later,
well, I think it's a form of fear-mongering.
imagine getting your morning train, commute this morning to Manhattan, and you find this waiting for you. Has freedom of speech gone too far, or is it all part of the mix here in America? Our panel's going to weigh in on that. Good evening, everybody, and welcome to RFL. I'm Richard French. Thank you so much for joining us this Friday evening, August 17th. We're going to get to all those topics, plus Dominic's one-on-one with mayoral hopeful John Liu, and my interview with the man who had to decide who got what in the aftermath of 9/11. But we begin with a fight over Medicare.
They think that if we end Medicare as we know it, make it a voucher system, then somehow this is all going to lead to jobs and prosperity for everybody.
The president's idea, for instance, for Medicare was to cut it by $700 billion.
They want to turn Medicare into a voucher program. That means seniors would no longer have the guarantee of Medicare, they'd get a voucher to buy private insurance. And because the voucher wouldn't keep up with costs, the plan authored by Governor Romney's running mate, Congressman Ryan, would force seniors to pay an extra $6,400 a year.
When he passed his signature health care achievement, Obamacare, he raided $716 billion from Medicare to pay for Obamacare.
All right, so you've heard some of the competing sound bites, and trust me, they went on all day today. And for all the nastiness, the injection of Paul Ryan to the race has at least ensured that this campaign is going to have something to do with substance. Two very clear differences between the two candidates here, as well as obviously their platforms. And it seems that the first Ryan-inspired flashpoint is Medicare. You've already heard how each campaign's spinning the Ryan plan, but what will it actually do? Let's take a look. The first thing you need to know about Ryan's plan is this. It does not apply to anyone who is 55 or older right now. Today's seniors would stay in the current system. For everyone else, the biggest change is that instead of automatically getting government health care coverage when you turn 65, you'll get a voucher that you can use to go out and shop for your own insurance. To start, the amount would be pegged to the cost of Medicare, which is now approximately $15,000 a year. Wealthy seniors, they get a smaller amount. The poor and sick, a larger amount. You would choose from a menu of private but government-approved health plans. One of your options would also be traditional government-run Medicare. Now, the prices of those plans would vary. More coverage costs more money. For any plan that costs over $15,000, you pay the difference out of your own pocket. If your plan costs less, you get cash back. The amount of money you'll get will rise slightly each year at a rate just over inflation. Will that be enough to pay for health insurance? Well, only if healthcare costs stop rising as fast as they have been. Ryan believes costs will come down because insurance companies will have to compete to get your Medicare dollars. That's possible, but certainly no guarantee. Now, while some Republicans might fear this fight over Medicare, seen as a political loser, one notable Republican strategist thinks politically it's going to help more than hurt. You may have seen this in the Wall Street Journal, a recent piece that Karl Rove penned saying Democrats, among other things, have long had an issue advantage when it came to Medicare. Republicans cowered in fear. This time it's different. The Romney-Ryan plan, he writes, is not only talking about Medicare, it's putting Mr. Obama on the defensive. If Republicans succeed, politics will never be the same. So, is it a political winner or loser for Republicans? And obviously we're talking about a key demographic here when we're talking about seniors or near seniors. Let's bring in our panel to get the conversation going. Dominic Carter, political journalist and author. Joe Carvin joins us, Republican congressional candidate in New York's 17th Congressional District. And Basil Smikle, political strategist, former top aide to Hillary Clinton and professor at Columbia University. Guys, thanks for a few minutes. As I said before, regardless of what political side you fall on, at least we're talking about stuff. We're talking about policy. What do you like? What do you think government should or shouldn't be? First off, there's a lot of back and forth on this, but do you like what Paul Ryan has to say on Medicare? I mean, you got to go to your constituents, prospective constituents here, and say to seniors or near seniors, either don't believe the hype or yes, this will hurt.
Well, I love what Paul Ryan's talked about. Remember, it's the only bipartisan plan. It's actually wide and so it's a bipartisan plan. Second point to make is it doesn't affect anybody 55 years or older. So if you're 55 years or older, there's absolutely no change. The third point to make, the Affordable Care Act funded itself in part with $716 billion coming out of Medicare. So as Karl Rove says it, he's absolutely right. For seniors 55 years and older, you're far worse off with the Democrat plan than the Republican plan. Now, where the change comes in is 2022. For people, for the next generation, we're trying to preserve and strengthen. Let's not forget, the Medicare actuary said Medicare goes bankrupt in 2024. 2024, that's not very far off. So ultimately, we need to adjust and strengthen and protect the program for the next generation of recipients.
There has been criticism of the Ryan plan beyond what's in it for some of the hypocrisy that people allege surrounds it. He had the same cuts that they've been railing at in his plan when it was laid out, the 760 number that we're talking about. And moreover, stuff that was in those cuts from President Obama, whether it's the donut hole coverage, prescription D for the Part D, for the prescription drugs, those were put in for cost offsets, and I think already it's translating over 6 months to $600+ for more than 1 million seniors in this country. Where is the facts in this thing?
Right, well, one of the facts is that the $700 million is not a cut from the system. It's actually savings that the White House believes that they can get through reduction in fraud and other matters of that sort.
And also that the HMOs will be putting
correct,
in.
and reimbursement rates and so on. It's all projection. Reimbursement rates, and the reality is that the Medicare program is solvent for at least the next 12 years. And this is, as you alluded to in your earlier question, this is really coming down to an argument about what you fundamentally believe the role of government is. And what the Romney-Ryan or Ryan Wyden plan is saying is that we want to be able to privatize this very important government program.
Your head. You don't agree?
No, actually, no, I don't at all. It's not privatizing. Ultimately, Medicare is bankrupt, and you have to fix it. And to pretend it's not bankrupt is being disingenuous. It's not. I don't think it's ideological. Mr. Daniels said the problems are mathematical. They're no longer ideological. Let's agree the math. Once we agree the math, then we can have a conversation about how to fix the program.
But just philosophically on the math, though, Joe, the Ryan plan, I don't want to get into taxes right now. I want to focus on Medicare. But his plan also says, I want to change the tax rate here to have 2 tax rates, 25% for the top end and 10 for the bottom end. He's reducing revenue by, I think projections have it, $4 trillion. And he's going to cut social programs primarily in here to get the number down. But my point is, we can't afford to fix Medicare if we choose to as a country. It doesn't have to go bankrupt. We could put more revenue in to keep it solvent. It's not an either-or option.
One thing I am as good as finance. I have 30 years business finance. The numbers are clear. You can't fix Medicare. You're going to have to change. You're going to have. I mean, I could take Simpson balls. The pain has to be shared. And there's no way you can fix Medicare by just increasing taxes. In fact, if you tried to make good on the promises we've made for Medicare, Medicaid, and Social Security, you would have to increase taxes 64% for the rest of your life, for the rest of your children's lives. It's unsustainable. It's not tenable. Read Simpson Bowles.
But you're a financial guy. Yeah. And to suggest that 10 years from now, somebody that's under 55 right now, that, hey, it'll keep up with inflation, you'll be fine, as if the cost for medical expenses, what do you say to somebody who all of a sudden is going to be out of pocket another $6 grand? Where are they going to find the money from?
What I say is you can't afford it. I mean, at the end of the day, or we're bankrupt.
But we can't afford lowering tax rates on the top end?
No, we got it. It's got the share. The pain has to be shared.
But his plan doesn't say that.
Well, yeah, actually it does. It's similar to Simpson Bowles. I had refused to sign the Norquist tax pledge. I'm perfectly happy for tax revenues to go up. I think the Republicans are painting into a corner, which is unfortunate in that regard. What we should do is what Simpson Bowles has argued. Simplify the tax code, bring down the corporate tax rate. We're the highest corporate tax rates in the world. Bring down the individual tax rate, keep more money in people's pockets. And when you do that, I think revenues will increase. And you close the tax loopholes. There's $1 trillion in tax expenditures.
I want to get so much
Sure.
more into with you. Tom, just put a political bow on this, because this weekend you got Paul Ryan's taking his mom with him to a Florida senior home. Obviously, they know the optics of this don't look good. Is this going to hurt or help? I saw Wisconsin poll numbers, they're inching up, but it's his home state. Is this issue, seniors are a key demo here, how's this going to play out?
It's going to hurt Republicans. I understand your argument that, you know, we're up against a time clock here where, it's going to run out. But the fact of the matter is, Ryan's plan is so draconian in terms of the impact on people, and people are afraid to death of this voucher system.
Could they, you heard what Karl Rove said, agree or disagree with him? He's got good optics on this stuff. Do you believe that there's a way to message or spin this for the Republicans
I
in 90
don't,
days?
because Medicare has always been the political third rail for Republicans. And I don't see how they're going to box. They're trying to throw it on Obama, but I don't think it's going to work in this case.
I got to go to a break here, guys. When we come back, we're going to keep the conversation going, and I want you at home to keep it going as well. Go to our Facebook page, facebook.com/Richard French Live. Sound off. What do you make of Ryan's Medicare reform? Does it go too far, or do you think it's tough medicine for tough times? You can also tweet us your responses as well. We're going to take a quick break. When we come back here, we're going to talk more on politics. Mitt Romney came out today and addressed the tax issue, and he said, that's it. Is it enough? We'll talk about that and more. Stay with us.